Thank you so much for the opportunity to come here and talk to you guys and tell you a little bit about some of the work that my team and I are doing at UIC. I started out doing tobacco control media research probably about over 15 years ago. And 13 years ago when I joined UIC, Kate and I started out there together on the same project. So it's kind of nice to tie things back. But back when I started out doing media research, the media environment was a lot simpler, so it was just easier to do the work. There were certainly complexities, but I think that things have changed so quickly and in such complex ways that it really demands a new paradigm. So that's what I'm going to talk about today. And I'm going to give some examples of some of the research that we've done that kind of builds on this idea of a new paradigm. So as Joanna said, I'm from the Institute of Health Research and Policy. The group that I run is called the Health Media Collaboratory. This is a few of the team members. And we're committed to doing rigorous research with health media data with the idea towards improving health. So just an overview of the talk today to give you a roadmap. I'm going to give you just a brief history of kind of how we started out with this research agenda, the new media paradigm. I'm going to focus on some research that we've done on Twitter and give an example of, I'm going to talk a little bit about the methodology and why it matters so much, to me at least, how you collect and analyze the data. And I think, I'll get into that. And then two examples of studies, one on a tobacco promotion of e-cigarettes on Twitter and one of an evaluation of an anti-tobacco media campaign. And then I'm going to talk about what social media cannot tell us and how do you kind of fill in the gaps and then hopefully wrap it up. So before 2011, essentially, my team and I were looking at anti-smoking media campaigns and anti-drug campaigns and to some extent anti-obesity media campaigns. And typically these were televised ads, paid promotions by state health departments. And the paradigm was really pretty simple and based on the traditional health behavior models where people are exposed to a message, that message affects their attitudes and beliefs and ultimately their health behavior. And that might be influenced by their demographic characteristics, how old they are, their education level, their race, might be influenced by other contextual factors like the tobacco control environment or anti-drug laws or something like that. But it was a pretty easy model to deal with. In about 2010, I was thinking about putting together research proposals, and I was watching TV on Hulu and reflecting on buying more advertising data. And I thought, oh no, people aren't watching TV anymore. I'm going to be out of a job in 5 years, and I've got to put my kids through college. So I got to figure out another thing to look at. So we started to look into and think about internet advertising. And still kind of in the mindset of the old media paradigm where you're seeing banner ads and kind of passively exposed to messages. So we're kind of playing with that and figuring out how to get data and what that meant. And at the same time, multitasking at work and checking in on Facebook and experimenting with Twitter and all of a sudden, wait a minute, this is completely different. This is a whole new paradigm. Before I go there, I got lost in my narrative there, but some of the lessons that we learned in the traditional media research where we were buying advertising data and looking at the impact of, for example, the anti-smoking ads, was basically that more of the good stuff is good. We showed that more anti-tobacco advertising was associated with less smoking, more quitting, and more anti-smoking attitudes and beliefs. And interestingly enough, the ads that were temporarily on the air that were produced by the tobacco industry that were actually anti-smoking ads on their face, so the surface, were associated with more smoking. So that gave us an indication that it's not just the message of the ad, but how the ad is executed. So that was an interesting kind of twist after we found out the obvious, more of the good stuff is good. more of the bad stuff is bad. Why is it bad? Well, it seems that there's something about the message content that really matters. But as I was saying, starting in about 2010, I started to get really worried about job security and just making sure that we were, really doing research that reflected real-world experiences. So we started to think about social media, and if putting it in the context of today, it's nearly ubiquitous. Almost 81% of adults are online. 2/3 of homes actually have broadband access. So people talk a lot about the digital divide, and that certainly still exists, but it's nuanced now. Most people have access to broadband. Everybody has access to internet. Different platforms may have different implications for what people have access to and can do on the internet, but everybody's on it. 69% of adults are on Facebook, 18% are on Twitter. Most people, while they're watching traditional TV, are actually doing something on another screen as well. So there's lots of different opportunities, not just for exposure, but to look for information. For example, if you see an anti-smoking campaign, most people have another screen and can Google the campaign or Google ways to quit smoking or share with friends that they just saw this cool ad on TV or this horrifying ad or whatever. So I think it's really important that not only are there are these other platforms, but the way that we consume media is fundamentally different than it was even 5 years ago. Among teens, social media patterns are even more impressive. Everybody's on Facebook, although they're starting to leave Facebook because we're on Facebook. But 26% of teens in 2012, so I think it's closer to 30% or more now, are using Twitter. Instagram use, I think this is just an obsolete statistic. I think it's way up. The only one that went down is MySpace. So anyway, I think these new patterns, these new ways of interacting with media and using media demand a new paradigm. So it's not just about exposure anymore, but like I was saying, it's about searching, sharing, and being exposed, and how are those related to health behavior. And in turn, we used to just have kind of a one direction model, like exposure was associated with attitudes, beliefs, and behaviors. But now we know, since people are agents in this process, your health behavior may well influence what you're searching for, which then influences what you're exposed to and what you might share. So it's a mess, and it's still influenced by demographic controls and contextual variables as well. Whenever something is really complex and a mess, that makes me think, okay, well, the first thing we have to do is just keep it simple and describe what's going on. So that's what we spend a lot of time doing in my group, is just trying to contain our excitement about all of the changes and keep it simple so that we can really try to understand clearly what's going on. One of the first places that we decided to look was with Twitter. Not as many people use Twitter as Facebook, but again, Twitter is a simpler platform to understand. One, because Facebook has a variety of privacy controls. There's different types of messages. There's corporate and personal messages, which is true on Twitter too, but it's a cleaner medium to look at. And it's growing really quickly, so I think it is actually relevant. The other thing about Twitter that's really nice is that it represents kind of the whole spectrum of that complex behavior, because you can be exposed to a message on Twitter just by looking at your feed. Twitter is actually the second largest search engine that people use. I think over 2 billion searches per day are conducted on Twitter. So you can find really whatever you're interested in on Twitter. And of course, it's by its nature a sharing platform. So people see something, they share it, or they think something and they share it. So there's, oh no, my graphics didn't show up. I made this on a Mac, and this happens all the time. So at any rate, there's a couple of ways to get Twitter data, and one of the most common ways is to go through the public API, which is free. Anybody can access it. But it's about a 1% sample of everything that's on Twitter. And that's important to think about in the context of public health, because a 1% sample of what Justin Bieber is tweeting about probably gives you a pretty good feel for what people are thinking about Justin Bieber. but a 1% sample of the 10,000 messages about a state media campaign really only gives you, 100 messages? And that gets really thin for analysis. It's not clear that you're getting something that you can really generalize. This was animated. I have good people helping me with my graphics. So you can see here that Justin Bieber has 45 million followers. In comparison, CDC has 200,000. So it's kind of sad, but it really makes it important in my mind that we capture everything that people are promoting for public health and saying about public health type topics. So as a result, we looked into getting access to the full Firehose of Twitter, and that's what we do now. So out of all the messages that are broadcast and shared on Twitter all the time, we pick up everything that we think we can find related to tobacco use. In addition to the actual messages, the 140 characters on Twitter, Twitter's a really rich data source because of the metadata, the data about the data. So in addition to the message itself, we get the geolocation of a small fraction of the users, but the username and bio, which often includes geographic location, the number of followers, the number of people they're following, the clout score, which is kind of a black box metric. We don't know what goes into it, but it's a measure that's commonly used of influence on the internet. So Barack Obama, for example, has a clout score of 100. I've got a clout score of like 40. So I have much less influence than Barack Obama. We get the hashtags, we get the URL of any website that people share along with the content. So there's a lot to work with the Twitter data. When we started collecting Twitter data in 2011, there was no historical archive of Twitter data that was available. So you couldn't just go looking back for topics you were interested in. It was just this stream of data that was happening, and if you jumped into it, you could get what you wanted. But if you didn't grab what you wanted, you could not go back. And that really forced us into a position of thinking strategically, how are we going to collect data for a big research project when we know that there are ways that people talk in real life as opposed to in tobacco control research, and there's just policy events and other cultural phenomena that happen that you cannot anticipate. So if you strategically select keywords that are very specific to what you're interested in this type of setting, you're going to miss whatever you haven't kind of prospectively identified. And I did not have a great deal of confidence that we would be omniscient and be able to capture everything that might be relevant. So instead of using a specific set of keywords, like we're all trained to be prospective in our research and come up with hypotheses and test those hypotheses, we went really broad, and we just cast a big net of keywords. And the way that we went about this was identifying major constructs that we were interested in. We knew that we were interested in tobacco behavior, so smoking, quitting, those types of behavioral words. Policy issues like smoking bans, cigarette taxes, tax evasion, smoke-free air laws, that type of thing. And then branding and marketing. From the tobacco control side, you've got the state campaigns, federal campaigns, but also the tobacco promotion side. We anticipated the brands promoting, but we also were interested at the time, e-cigarettes were just coming online, so we started to think about e-cigarettes. So we went very broad is the punchline there. So part of the challenge of when you go broad like that is that you get, just like people who fish in the ocean, they get what they're searching for, like the tuna, but there's a bunch of other junk in there too, like barnacles and tires and garbage. So that has been a major problem for us, or a major challenge, I should say. So we tried to be methodical about the way we did this and generated a broad pool of keywords, screened the keywords for relevance and how often those keywords actually captured content that we were interested in. We discarded keywords that returned poor results, and we added new keywords as we viewed the content and saw different ways that people were talking about tobacco. And for example, we're interested in quitting smoking and smoking cessation. We talk about that all the time in our group. It turns out that nobody on Twitter talks about smoking cessation. But a lot of people talk about quitting. A lot of people actually don't talk about cigarettes. They'll talk about smoking squares or other slang for tobacco products that we really had to learn. And in that process, we decided that we had to be kind of methodical and refresh our list of keywords, test our list of keywords, and really assure ourselves that we're getting what we want. Because when you're dealing with this volume of data, thousands or even millions of tweets, a lot of the analysis is not done by humans, but is done by computer algorithms. And if you put a bunch of garbage into a computer algorithm, you're going to get a bunch of garbage out. So we wanted to make sure that we could quantify how clean our data were so that we could quantify how confident we were in the analysis that we were running. In the process of doing all this keyword data collection, we've collected almost 240 million tobacco-related tweets. We have organized our Twitter data by topical collections, so we've got electronic cigarettes, we've got smoking behavior, cigarettes, hookah, CDC tips from former smokers. So we've kind of segregated this garbage heap of data into the piles that we're pretty much interested in. One of the challenges, though, is that even once you've developed a pretty good list of keywords, face validity is not good enough. So for example, the keyword smoking, we've got, I don't remember how many, 56 million, we probably have more, closer to 70 million now, tweets that contain the word smoking. But when people talk about smoking on Twitter, they talk about smoking barbecue, smoking broccoli, which I don't think is about a vegetable, the anti-smoking commercial, which is relevant to us, smoking hot girls. So there's all sorts of things that we have to clean out before we get to the messages that we're actually interested in. And then, then you can count the messages that you're interested in. How many people are actually talking about smoking tobacco versus smoking hot girls? Not many. Well, what are they saying? Are the people that are talking about smoking tobacco are typically have like negative language, like they want to quit smoking or they don't like people who smoke or those types of things. But people that talk about smoking broccoli or smoking hot girls are very positive. So it's really important to kind of clear out the data so that you really are getting the messages that you want. And then going back to something that I referred to earlier, language is important, and understanding the language that regular people use as opposed to researchers is super important. So I live on the south side of Chicago, and I have walked down the street hearing people talk about smoking squares or do you have a square. Totally didn't register till I saw it in a tweet, and I'm like, oh, they're talking about cigarettes. And now I know that people are like selling loose cigarettes on the street in my neighborhood, but it just reinforced to me that knowing the language that people use is really important. So here's an example of a tweet with smoking squares. So this goes back to the idea that we need quality control and measurement, and that's something that my team has spent a ton of time on in the past 2 years, is developing methods and measures for assessing the quality of our data. So we do a lot of precision testing, which means that we look at our archives to determine the proportion of the analytic data set that we have that is clean and on topic. But then conversely, and in a much more challenging, is estimating recall. How do we know that we got the conversation that we're interested in, or the people, all of the conversation that we're interested in, not just some weird corner of the Twitterverse? So here's an example of when you use keywords, the circle represents the body, the corpus of tweets that are retrieved with a given set of keywords. And a lot of them may be relevant, so a good portion of that circle is relevant content that you want, but if your keywords are too narrow, you're missing a big portion of the picture. So this illustrates bad recall but good precision. Conversely, you may get most of the relevant universe, but a bunch of crap. So each of those things has different implications about how you proceed with the data, but if you don't understand what the picture is, how big your circle is compared to your square, you really don't know what you're dealing with, and I don't feel confident that we can draw good inferences from the data. And I think this is really important because you see a growing amount, I should say, of studies in the literature of incredibly varying quality. And people will say, we used the keyword smoking cessation and we found 9 tweets and we analyzed them and everybody wants to quit smoking. Like, where'd you get your tweets from? Is it a full Firehose? Is it a sample? If it's a sample, do you feel like it's an adequate size sample? How does it relate to the overall universe? Were they clean? So I'm concerned that if we as a group of researchers who are interested in media research do not develop standards and methods of measuring and reporting the quality of the data, that this type of research will easily be discredited by the load of crap that's already out there and just streaming into the journals all the time. And one of the other challenges I find as a researcher who I think does high quality research is that journal editors, grant reviewers don't have any guidelines or sense of how to evaluate good quality research from not so good quality research. So I think this is my little soapbox that I wanted to spend a little bit of time on. How you get the data and how you analyze the data really, really matters. And we need to understand that well before we can even talk about what you find from those data. Off my soapbox, segueing into the actual research findings. The first study I want to talk about is some work that we've done looking at the marketing promotion of electronic cigarettes on Twitter. Of course, I think probably there's nobody in the room who hasn't seen a promotion for electronic cigarettes. They really weren't on the US market in 2007, and now everybody knows about them. So that is what motivated us to look at that and question, what's going on Twitter? If this is such a big cultural phenomenon, we must be seeing something on Twitter. And what is on Twitter? And we're also interested in Twitter because, well, I'll go into that. The FDA doesn't have a clear regulatory status for electronic cigarettes, but we do know that in its current regulatory limbo, electronic cigarettes cannot be promoted as cessation products and they cannot be promoted as healthful alternatives to smoking. So like I said, you see electronic cigarette ads everywhere. That was an example of a televised ad that appeared, I think, on Netflix or Hulu. You see online banner ads, or some of us see online banner ads. It depends on your internet searching patterns. Another interesting thing about exposure to messaging when you go from traditional broadcast media to the internet is the messages that you're exposed to are really determined by who you are. So it's a very endogenous process. So if you're already looking for related products, or if you fit a particular demographic profile, you'll see a lot of electronic cigarette ads. But there might be several people in the room who've never seen an electronic cigarette ad on the internet. So it becomes a much more complex thing. So the questions that we were interested in were really very simple to start out with. How much electronic cigarette promotion is there on Twitter? And how much of that conversation is organic versus promotional? This is a pilot study. We've continued on with this, but between May and June of 2012, we went to the Twitter Firehose to capture all electronic cigarette tweets and the related metadata. And we used both human and machine coding to look for mentions of smoking cessation and evidence that the tweet was from a real person versus a company promoting electronic cigarettes. So here's the list of our keywords that we ended up with. And again, you can see here some of them have automatic face validity, electronic cigarettes, blue, enjoy the brands, e-cigarettes. But then you get to things like vaping, which before we started looking at the tweets themselves, I certainly didn't know what vaping was. Now I do. So it just speaks to the importance of really being kind of thorough and broad with the keywords. So our findings are really pretty simple. You can see that top row, commercial/advocacy, represents about 90% of the tweets that we collected in that 2-month period. So we collected about 73,000 tweets that we felt were relevant. Only about 10% of them were organic. The proportion of total users to tweets was fairly comparable. I think the commercial accounts tweeted about twice as frequently about electronic cigarettes as the organic tweets. which makes sense. Once you've said, I love to vape, what more is there to say? I like strawberry vaping. That's my second tweet. So that's a pretty simple finding, but I think it's really important that the vast majority of the content about electronic cigarettes out there is promotional. So despite the rapid growth in promotion and use of e-cigarettes, most of what people are talking about is not, most of the chatter on the internet is promotional, or on Twitter. And we can see here by looking a little more deeply into the data that one user accounted for almost 20% of all the tweets out there, which is a nice little clue, a circumstantial evidence that that's probably not a person. So you go down, the top 10 users out of that 70,000 accounted for a third of all of the material. So right there, that gives you a clue, like, look at these people, look what's going on, where are they, what are they tweeting, what other things are they promoting. So this is just another little visualization of the data where we were able to show the connections between the accounts and the websites they're tweeting to. So all the little dots in the periphery are probably small vendors that are just tweeting once or twice about a particular website, or it might be an individual saying, I bought my starter kit at this place. But you can see these little flowers of activity that suggest that's a place we want to look. What are these accounts doing? How are they related to each other? And I don't know the answer to that yet, but I think by delving into the data and seeing what's there, it just leads us into another path that we really didn't anticipate going into it. With the health and safety claims, we see about 2% include keywords or content that suggests they're promoting it for health, another 1% safety, but 11% mention cessation or quitting smoking or that type of thing. So about 14% of all of that activity out there is using language that's explicitly illegal, which I think is really interesting. And then another 30% mention price discounts, which I think could have important policy implications depending on how FDA decides to go. So the punchline is that electronic cigarettes are marketed heavily on Twitter. 70,000 messages in 2 months is a nice amount. Most of the messages are electronic cigarettes. The metadata provide important clues that I think warrant following up, that we'll learn a lot about the nature of marketing electronic cigarettes on Twitter and on new media in general. And we see evidence of potential regulatory issues that the FDA could act on. Turning from tobacco promotion to tobacco control, we've also used Twitter as an evaluation tool. And the question that we were interested in is, can Twitter be used to evaluate media campaigns? So we looked at the tweets in the context of the extended parallel process model, which is a communication theory, where we were evaluating basically whether people embraced the message of the CDC Tips campaign or rejected it. And I'm not sure how many people saw the Tips from Former Smokers campaign, but it was the largest national anti-tobacco media campaign undertaken by the government. There was the first wave in March of 2012, and there was a $50 million media buy. Most of it was television advertising. They were very graphic ads that featured the health consequences of smoking among real people. So there was the lady with a hole in her throat. There was the guy that had the heart surgery, person with amputation. And it was a kind of controversial approach because a lot of people thought that graphic imagery and the real suffering would turn people off from the message. So there was a lot of discussion in the tobacco control community and the media evaluation community, like, is this going to fail because it just turns people off? So we decided to try and answer that question using the Twitter data, because Twitter's the largest focus group on the planet, and if people are talking about something, we can really get a lot of sense of what people are saying. So curating the tweets for the CDC Tips campaign was pretty challenging, especially the first time around, because there was no hashtag. So we had to actually look at the ads and anticipate what people would be saying based on the content of those ads. So we developed a set of keywords that were specific to the Tips campaign, but we also pulled from our more general archive of the tobacco behavior. And for the 3 months of the 2012 campaign, we initially collected about over 100,000 tweets. After we deduplicated them, we had about 80,000 tweets that we thought were potentially relevant to the campaign. After we precision tested them and cleaned them to make sure that they were on topic, we used human coders. We used 2 coders for each coding set and measured the agreement between the coders to assess how well we were doing. Then we trained the machine. What we ended up with were about 60,000 tweets, about 80% of our deduplicated data that we felt was really on topic. That represented 54,000 unique users, which is a fairly impressive amount of engagement with the campaign. At least 5 million unique impressions. So what people said on Twitter was potentially viewed by about 5 million people if you count the followers of all the people who tweeted about it. Importantly for kind of our research, thinking about how people use media, is 80% of the people that were tweeting about this campaign did it using a mobile device. So that, again, kind of reinforces that idea of the multiple screen approach. We decided to focus, just for practical purposes, on the hole in the neck tweets to really to assess the whether people accepted the message or rejected it. And I'm sorry, I did not censor these, so there's some shocking language. So once we sifted through our collection and just focused on the hole in the throat bucket, we found that about 1 in 4 of the tweets about the campaign were about that set of ads with Terry, the lady with the hole in her throat. And we looked, again, for fear arousal versus rejection. An example of a fear arousal message was, man, that smoking commercial lady has a hole in her throat, scares me every time. Rejection, this person, oh, I did censor this one, rejected the message. So again, we trained the machine using human coders that coded about 1,000 ads in total. Out of that 14,000, and then let a machine learning algorithm code the rest. And we found that about 82% of what we collected gave evidence of fear arousal, which to us was nice evidence that the campaign had the desired effect. And it reinforces, it kind of fills in that black box between calls, the increase in calls to the quit line. Like, people really got the message. It wasn't just the tagline, but it was the message. So here's some more examples of just the most frequent words that occurred in those fear arousal ads. An important aspect of this that we learned and that I really firmly believe in is that in a lot of social media research will report sentiment analysis, where people feed tweets through these commercially available platforms for that use buckets, use standard kind of emotion dictionaries to say these are positive or these are negative. And that works pretty well with brands like United Airlines or Coke or whatever. If people are talking about Coke, Coca-Cola, and they're saying something bad, usually they'll use negative language. But in the context of evaluating a health campaign, negative can be really positive. So to me, it's really important as researchers not to just fall back on these black box tools, but to really understand the substance of what you're looking at. The 20 most frequently used hashtags, this is just a slide to evidence. You don't see CDC in here at all. So in terms of media campaign design from the tobacco control community, they're not, the tobacco control community, I venture to say, health advocates in general are not taking control of the narrative. The narrative is happening, and it may or may not be going in the direction that people want. But I think that commercial campaigns do a lot better job of controlling the narrative and really interacting with hashtags and developing them and disseminating strategically. So the punchline for that little bit of research was that 1 in 4 tweets referenced stoma ads. So that was, if you look at the portfolio of ads that CDC ran, and if CDC is looking at resource allocation, those ads were really effective. People connected with those ads. The majority of people accepted the very graphic, threatening messages. And the punchline for us when we talk to CDC is, we can't tell you whether your ads made people quit smoking, because people aren't talking very much about that on Twitter, like, oh, that ad makes me want to quit. But they are talking about how the ad makes them feel. It's a process measure. So we can use these media, at different phases in the evaluation process, but we really have to understand kind of what stage in the process is the most appropriate for each research question. So at the end of the day, though, social media data are super interesting and super exciting to research and really challenging, but there's still gaps in what we can understand. We really don't know much about what individuals are saying and what audiences we reach. We don't know much about the demographics. We really don't know, if more women or men or high or low socioeconomic status. We know virtually nothing about race and ethnicity, very little about geography. People will talk about how you can infer geography from Twitter, but it's about 3% of tweets have enabled the geolocation. Another third have information that you can kind of triangulate and make inferences, but you need sophisticated computer algorithms to do that. So it's hard to link to geography. And it's really hard to establish a causal link with these data. You can observe and describe what's going on, but you can't very easily say this causes that. So we also have been conducting population-based survey research to kind of fill in those gaps. What I'm going to talk about today is the portion of our survey research that's looked at electronic cigarettes and how much information people are exposed to, search for, and share related to electronic cigarettes across a variety of media platforms, and then what are the correlates of exposure, searching, and sharing. So we conducted a national survey last February. It was an online survey of about 17,522 respondents. We used GFK, which used to be Knowledge Networks, so about 2/3 of our sample was actually a nationally representative panel, and we filled in with convenience sample from market research that panels that they also use. We oversampled tobacco users. We went for such a large sample because we wanted to get representation at geographic areas that more or less corresponded with media markets, because we're interested in the relationship between social media and traditional media. So we wanted to see if there's varying patterns of exposure, searching, and sharing tobacco-related information depending on where people live. And the survey allows us to describe individual behaviors and also construct these population measures at a geographic level that we think is relevant from a policy perspective. We collected data on a variety of constructs, most importantly media consumption and access. So we had a baseline of, what are you doing online? Are you online? How often are you online? What platforms are you on? And then specifically on this you say you're on this platform, have you ever seen anti-smoking content? Have you ever seen pro-smoking content? You say you're on this social media, have you ever searched for, have you shared? So just a whole host of media consumption questions. Tobacco use, of course, cessation behavior, attitudes, beliefs about tobacco, and exposure to tobacco promotions. The key questions that I want to talk about today are, have you ever heard of electronic cigarettes before you took the survey? And have you ever seen, heard, searched for, or shared information about any of the following topics? And we had a list of 8, but I'm going to focus on electronic cigarettes. To put it in context, nearly all of our sample was aware of electronic cigarettes, 95% of current smokers. So that's significantly higher awareness among smokers than among not smokers. We also saw significantly higher awareness among LGBT than non-LGBT. Ever use, we found 15%, which is much higher than the most recent national surveys, but I think I feel very confident because it is a representative sample and it's such a big sample. So I think that just reflects the rapid growth in use of this product. 50% of current smokers said that in the last 30 days they had used an electronic cigarette. 23% of young adults, 25% of LGBT respondents, or ever use, sorry. Current use was 5% of the general population, but 4 times that rate among current smokers, twice that rate among young adults and LGBT. With exposure, searching, and sharing, it was really interesting to me. I had expected, because I'm immersed in social media, to see a lot more searching and sharing, but we see wide exposure. Almost half the sample said that they had seen or heard something in the last 30 days about electronic cigarettes. Only 5% said that they had searched for, but if you think about the current use statistics, that's about on par. And about 2% of the overall population said they shared something. If you conditioned shared on searched, 16% of those who had searched for something shared it. So I'm just going to flip through a couple of really fast graphs that show interesting differences between tobacco users and non-tobacco users. Between men and women, there's not such big differences. By race, ethnicity, you see significantly more sharing among Latinos than the white or non-Hispanic Black populations. Education, you see more searching and sharing actually by people who have some college or high school grads. And I think this is actually not so much an education effect as an age effect. Because then again, you see the nice age gradient that you would expect. Interestingly, and I think importantly, we went after getting a large LGBT sample, and I think we've got one of the larger LGBT samples of tobacco behavior. And we see much higher use of searching for and sharing of electronic cigarette information by LGBT community members. We were interested in going beyond just the descriptives to look at what are the correlates of exposure, searching, or sharing. So we had a model for each that the dependent variables, a function of demographics, tobacco use, media access and use, where they live, and then an error term. And it turns out for electronic cigarettes, where you live doesn't really matter, which is not surprising because I think there are national media campaigns right now, and there's very few local regulations that pertain to electronic cigarette use. So this is just, I pulled out some of the most interesting findings that really confirm the cross-sectional or the bivariate analyses. You see much higher rates of sharing and searching among LGBT, much higher rates of sharing among Latino compared to the other populations, and much higher searching, sharing, and exposure among tobacco users compared to non-tobacco users. So the punchline is, in 2013, almost everybody's heard of electronic cigarettes. There's important demographic differences that suggest that these are either differentially appealing and or they're being targeted by marketing among particular groups, especially young adults, LGBT, and less educated, but I think it's the age thing. The next step with this research is to really kind of try and understand that targeting and what are they saying in the ads. So the conclusions, I whipped through a ton of material and highlighted only some of what we're working on. I skipped over some work that Kate and I have done looking at online news content and gathering all of the commentary related to that news content about the TIPS campaign, which just is another media platform that, in my mind, reinforces kind of the idea that looking at one media platform is interesting, but they're all so interdependent now that we really, at best, can kind of get a sense of the cultural vibe, and then within that, describe what's going on. But it's challenging because of the complexity right now. So I think we're really at a stage where description is the most important thing we can do. This is obviously a team effort. It's a ton of work. We, as a result, have more data. I'm sitting on more data than I can possibly analyze or have anybody in my team analyze in a lifetime. So there's opportunities. And I think that the methodologies that we're working on and have developed are very translatable to other health behaviors. So this research was funded generously by the State and Community Tobacco Control Grant out of the National Cancer Institute. You can find out more information about the range of work that we're doing by going to our website, or like us on Facebook, follow us on Twitter, read our blog, and I welcome any questions if there's time.
I'm curious how, if at all, it's possible to understand the role the tobacco industry might be playing with some of the tweets and content. And is it, I mean, sometimes when I see
I am
these
too.
reports, I read the comments, even though every year for New Year's I promise I'll stop reading the comments on newsfeeds. But some of them are so sophisticated.
Yeah.
I just think that's the industry. So is there?
You know, I think that there is, and I share your conspiracy theory perspective. There is no way that there is that kind of individual enthusiasm about electronic cigarettes. One of the things that we've noticed, we've collected actually 40,000 YouTube videos about electronic cigarettes and the related comments. And we are in the process of kind of prioritizing content coding. But you can tell a lot from the metadata. So I think that the metadata and looking at the linkages between accounts begins to give you some forensic evidence of so those little flowers, for example, on Twitter. One of our next things is, where are they? Are they offshore? I think they are offshore. We've got some computer scientists working for us to trace the IP addresses. And then the next step is to look at the content. So with both the Twitter and the YouTube data, we're actually prioritizing and looking deeply at content. And with YouTube, for example, you see, you pull up one and it looks like a guy in his mom's basement talking about his cool new e-cig starter kit. And look at this. And you look at 5 of them and the script is remarkably similar. And it begins to make you think, what a coincidence that all these guys in their mom's basement are really following the same narrative. So then, I think we'll go more deeply into the metadata, but I think it's like almost a forensic process because my hypothesis is that the tobacco industry is behind it and they've learned a lot from the regulatory process of the last 15 years. But I don't know. We're trying to figure it out. Go ahead.
So then you stated that you had some tweets that use specific illegal terms like helpful and things like that. Is there any way to, is there any way in the future we could look at those fake users and use that information as a hallmark for companies they require?
Possibly. I'm concerned that many of them come from, yes and no. And that was my first instinct as well. Been working with the computer scientists at UIC who've been looking more into the IP addresses and where these places are coming from. And it seems like a lot of this marketing is coming from India and like these server farms and marketing farms. It's automated bots, websites that are hosted offshore. So I'm not sure what the FDA can do to control that kind of thing. I think that it really calls for a stronger role of counter messaging and really the importance of the tobacco control community to kind of balance out these things that FDA or states really have very little jurisdiction over. Go ahead.
So on both of those questions, I guess, I'm wondering if you started to look at how you can use natural language processing to evaluate this, because with single search terms, you're kind of limited in terms of what people produce, and then you may find quite a bit of promotional material when there might be more nuanced language out there. And then, of course, it gets to the point of how you can identify fake users. If the narratives are the same, like similarities in the content of what's being produced, and as you start to look at it.
Yeah, we've started to, and I didn't really highlight that because I honestly don't really know what we're doing very well. We've started doing topic modeling. We're testing out different packages and different algorithms to see, does the bag of word methods work better than, word associations. So we're experimenting with that, but I was trained as an economist. So I'm kind of learning this stuff with a great team to support me, but it's interesting, and we're partnering with a guy at UIC who's really well known for detecting spam and fake reviews. So he does a lot of that, and we're beginning to overcome the language barrier between computer science and public health. So just like when I describe the problem, oops, that's right. He looks at me like, and then when he says, I can do this, this, and this, and after hours and hours of us repeating ourselves, it's slowly sinking in, and I think we're making progress. So, go ahead.
So I'm from the Center for Communication Programs here at Hopkins, and we do a lot of work in the developing world around communication campaigns for changing health behavior. One thing that we're really interested in now is adding social media as an element of broad campaigns that includes mass media and community level interventions, et cetera. So we're trying to tease out whether the social media is added value for changing behavior. But one thing that we're really interested in is this, what you we're getting at the beginning is this conceptual framework or a theory for behavior change just with social media. So I know you mentioned that, right now we just have a lot of descriptive studies and we can't make causal inferences, but I wanted to get your input on what sort of methodologies might get at, whether it's exposure, search, or sharing that actually results in change in attitudes or changes in behavior.
That's a good question, and my simple answer is I don't know. And the reason why we're doing kind of this parallel effort of massive social media analysis and survey research is to try and make those linkages. I do strongly believe, and this is a hypothesis, but my hypothesis is that it's not exposure or searching or sharing. They are interdependent, and one of the first things that we're working on is trying to understand that relationship between them and describe, I think there's different groups that approach the different cogs in different places. So I think that that's really the first step, is to try and understand, where is the community that you're interested in? Where's your target audience getting into that system? Is it through passive exposure, active searching, or social networking? And my hypothesis, just even based on our survey data, is that that's different. I think highly educated people are more likely to actively search for information. Communication theory, like health education theory, suggests that less educated people get more of their information through visual imagery, so exposure might be more important. Marginalized communities may probably obtain a lot of information through social networks and sharing. But I think that the answer to your question is not one or the other, but it's contingent on the community that you're interested in and kind of where in the system is the best entry point. Does that make sense?
Yeah, and a small question related to that. So the idea of sharing, another thing we've been grappling with is that us pushing out messages, say on Facebook, we use Facebook more than Twitter in a lot of the communities we work in, or is it the interaction of our audience that creates?
That's a good question, and I'm gonna step aside as a researcher because I don't have data. It's just real data. I have anecdotal data to support what I'm saying. But I think the CDC's media campaign was very effective on the traditional media platforms. I think it completely fell flat on social media because it was a very top-down approach. They tweeted out, but nobody listened. They got 203 followers out of how many hundreds of millions of people in the United States? So I think that tobacco companies are certainly engaging with their constituents, their buyers, in a very active way. And I think that there's opportunities for tobacco control or health advocacy groups to engage in that conversation. And it may start with a push message, but it can't just be left hanging there. And I was telling, I think, Ashley earlier about Kate's and my project analyzing just the commentary on news about the CDC TIPS campaign. So all the news was just the press release, the CDC press release. And we found how many thousands, tens of thousands of comments. Off of 35, there were 35 stories nationally online about this $54 million media campaign. There were tens of thousands of comments related to these 35 stories. CDC did not engage with any of these, and the narratives in the commentary were going off on the nanny state, and they suggested, to me, my conspiracy theory was that the comments were stacked by advocacy groups. But there were opportunities, I think, for CDC to engage and learn from what people were saying and counter message and say, $54 million campaign is a drop in the bucket compared to how much the tobacco industry is spending daily to get you to smoke, or how much the states spend yearly on the health effects of tobacco. So I think there's opportunities to reframe the narrative. In that context, it may have influenced the success of the media campaign or the impact of the media campaign. I think it was still a successful media campaign, but there were missed opportunities because it was a push instead of a conversation.
Thinking about the related to what you just say now, that instead of looking at what people tell, or what the narratives are about their individual behaviors, or how they feel about themselves, or smoking, or how they feel about the campaign that directly attacks that. What about the, if we get to exploring the narratives about the policies or laws regarding smoking? I think in principle, I'm talking example, but the Bloomberg had then last the soda in New York. I
Yeah.
guess there has to be something on how people reacted to that. So using that for tobacco, I'm sure it would have been more useful in the 80s where all these new tobacco laws were being enacted. Right now, I'm sure that there is something there.
I think you're right, and I think we just haven't. We've collected a lot of that data, and it's sitting in our big garbage heap to get sorted out and analyzed. And in fact, that also touches on something that I've just observed in the data. We have collected a ton of tweets about marijuana, because smoking, probably at least half the tweets that contain the word smoking are about smoking marijuana. And just looking at the timeline over which we've collected the tweets, that happened during the election period. So you could really see probably just as simple as the volume of tweets in places, and I think there's enough information that you could look at it relative to what was going on in Colorado and Oregon. And another anecdotal thing that we see is everybody's really enthusiastic about smoking marijuana, but everybody's really down on smoking tobacco, which is the legal product. So that there's got to be something there, but we haven't done anything with it. And if you're interested, I have lots of data. It's time to wrap up.
So,
Okay.
Thank you so much. I think it was particularly interesting to hear your thoughts on the challenges of doing research in this emerging area, because we all sort of see the papers being published, but this certainly gave me a better understanding of how to critically look at that. So thank you so much for being
Thank
with
you.
us. And I think Dr. Emery will be around for a few minutes.